Mr. Spicer, and this is a short overview on social justice model that we are going to be using for this course. So, in together with the circles of sexuality and the trauma-informed care systems and principles and social justice, we are going to create an understanding of sexuality that will allow you to be a great practitioner and force for change in the world. So let's talk about social justice very briefly. So social justice incorporates social issues that involve the individual, the family, the community, the wider society, and even the international community. It refers to unfair treatment or inequities that have resulted from racism, sexism, socioeconomic, sexual orientation, religion, ableism, and other isms, all of which affect quality of life. Social justice constitutes the right to fairness and equity. So this comes from social justice as the fourth theories and concepts, and that is something that I have posted in course documents for you to look at. It is a lot of information for you to take in, but I think it's a great explanation of social justice that you should consume, and it will be of great help to you in this course. So here's something that I really like out of this, the fifth force, and that it's just a little model that sort of shows you the rings and the complicated nature of social justice. The world is not direct cause and effect that's that easy to determine. It's complicated. So you have to consider societal factors, worldviews, cultural stuff, psychosocial things, sociopolitical things, historical things, ecological considerations, and you can follow lines in. There's types of injustices, human rights violations, abuse, violence, powers and privilege differentials, poverty, unfair treatment. So all of these things and who the targets are, communities, other families, institutions and systems, other support networks, all these things come together to the middle for the individual and family psychological well-being and quality of life. And that's really what it's all about. As we want people to have a good quality of life. And thinking about sexuality, listen, sexuality is a taboo topic, and there have been many human rights violations, societal inequities tied to sexuality, especially where women are concerned. So there's a lot of work to do here. There's a lot of understanding that we need to get to. So understanding this model is going to be a work in progress, so to speak. So this isn't something that you can just present and I can give you a process for plugging into it. You're going to have to consume the information, and then things will, lights will go on as you start doing assignments. And I've worked out a bunch of assignments for you to work within this information. So that's basically my small introduction, my very short introduction to the social justice model that we're going to be using in this course. Welcome to the model overview for trauma-informed care. So trauma. Why are we talking about trauma in a sexuality context? Well, to some it's obvious and to some it's not. One of the things we want to do with this model is really heavily weave it into our understanding of sexuality for the following reasons. First, trauma is pervasive. So national and community-based surveys find that between 55 and 90% of us have experienced at least one traumatic event. And individuals report on average that they have experienced nearly 5 traumatic events in their lifetimes. The experience of trauma is simply not the rare exception we once considered it. It's part and parcel of our social reality now. So it's not something that we can ignore. It's not something that we can, deliver good service without considering. So the impact of trauma is very broad and it touches many life domains. So trauma exposure increases the risk of a tremendous range of vulnerabilities. So mental health problems like post-traumatic stress disorder, depression, excessive hostility, generalized anxiety, substance abuse, physical health problems, interpersonal struggles, eating disorders, suicide, and more. Trauma thus touches many areas of life not obviously or readily connected with the experience of trauma itself. So this broad impact makes it particularly important to understand the less evident links between trauma and what follows. So the impact of trauma is often deep and life-shaping. Trauma can be fundamentally life-altering, especially for those individuals who have faced repeated and prolonged abuse, and especially when violence is perpetrated by those who were supposed to be caretakers. Physical, sexual, and emotional violence become a central reality around which profound neurobiological and psychological adaptations occur. So survivors may come to see themselves as fundamentally flawed and perceive the world as a pervasively dangerous place. So it really shapes a person's worldview. And this isn't something that people turn on and off, or maybe some people have triggers, but maybe some people don't even need triggers. They're just already in that default position of readiness and hypervigilance. Violent trauma is often self-perpetuating. So we know that people who are victims of violence are at increased risk of becoming perpetrators themselves. So this is well documented. It's intergenerational transmission. And community violence, it's often built on cycles of retaliation. So community violence, and even now, with the world the way it is now, we see it's international. So many of our institutions, criminal justice settings, schools, churches, hospitals, are also too frequently places where violent trauma is perpetuated rather than eliminated. So these are things that we really, really need to address. Trauma is insidious and preys on the more vulnerable among us. So people who are poor, who are homeless, who have diagnosed with severe mental health problems, addicted to drugs, developmental disabilities, all these groups are at increased risk of violent victimization. Trauma affects the way people approach potentially helpful relationships. So, not surprisingly, those individuals with histories of abuse are often reluctant to engage in or quickly drop out of many human services. So being vigilant and suspicious are often more important and thoroughly understandable self-protective mechanisms in coping with trauma exposure. But these same ways of coping may make it more difficult for survivors to feel the safety and trust necessary to helpful relationships. So it's something that you have to understand. If you're going to reach out to people who need your services the most, there's a certain way that you're going to have to do it. Trauma has often occurred in the service context itself. So involuntary and physically coercive practices, as well as other activities that trigger trauma-related reactions, are still too common in our centers of help and care. And something that we struggle with, reproductive health. You can imagine the vulnerability of receiving reproductive health services. And if somebody has trauma, if you're not delivering trauma-informed care, you could re-traumatize somebody. Trauma affects staff members as well as consumers in human service programs. This is something that a lot of people don't think about. Everybody think about it. You think about trauma-informed care. You're only thinking about the person that's receiving care. No, it's the caregivers as well. The stressors deeply affect administrators, even clinicians, and support staff working in human services. Not only is secondary or vicarious traumatization common, but direct threats to physical and emotional safety are also frequent concerns. So being asked to do more and more with less and less becomes a pervasive theme, underlying work experiences that may threaten to overwhelm our coping abilities. So self-care in the workplace now becomes, don't just take care of yourself, but we all have to take care of each other. We're going to have to work on that together. So the principles of trauma-informed care are something that we're really going to be weaving into our understanding of sexuality. So the first is safety. This includes where services are offered, the time of day that services are offered, security personnel there, open doors or locked doors, the effect anything like this has on people, what the waiting room looks like, are seats close together, does it smell? All of these things are things that you have to be attentive to. Are all staff members attentive to signs of consumer discomfort, or do they recognize these signs in a trauma-informed way? We need to ask these questions. The next is trustworthiness. This includes providing clear information about what will be done, by who, when, why, under what circumstances, respectful and professional boundaries. It is unnecessary consumer disappointment avoided. So, that's just a way of saying, are you really are you cutting corners? What's that extra step you could have taken to make the whole thing really nice, and you just neglected to do so? Maybe that's a sign that you don't even care. Is informed consent taken seriously on a consistent basis? Okay, that's trustworthiness. The next is choice. This includes how much choice consumers have over the services they receive, time of day, gender preferences for service providers. That's something that's really big at Planned Parenthood, as sometimes, when a young girl comes in, she doesn't want to see a male provider. Not that that's likely, although we do have some male docs. Most of our nurse practitioners are females, but she should have that choice. And being forced to see a male doc just because that's who's available is not something that is a trauma-informed practice. It is something that we really need to accommodate. Okay? And our patients and consumers provided a clear and appropriate message about their rights and responsibilities. That's choice. Fourth is collaboration. This includes giving consumers a significant role in planning and evaluating services. Consumer preference is given in areas of service planning, goal setting, developing treatment priorities, cultivating an atmosphere of doing with rather than doing to or for, conveying the message that the consumer is the expert in their own life. So if you're talking about, medical care, it's not fully prescriptive. You have to have a conversation with your patient to see what the best course of action is. And another way that you can do this is make sure you have patients on your board, or making policies and contributing to procedures so that your patients and the people that you're servicing are represented in the decisions of your organization. The last one is empowerment. This includes recognizing consumer strengths and skills, building a realistic sense of hope for the client's future, providing an atmosphere that allows consumers to feel validated and affirmed with each and every contact at the agency. So, some of this may sound just like sound customer service, and it really is. So if you're a student of customer service and you've ever been to any kind of workshops like that, there is an intuitive level where you're trying to provide a trauma-informed environment, but it doesn't go far enough. And it certainly doesn't come with the understanding of trauma and its effects and how you can deal with people that are experiencing it. So that's why this is so important. Finally, here's a little bit of a chart, and this is also provided as a handout in the course. Trauma-informed versus not. So some of these things that you can see here, recognition of high prevalence of trauma, that's trauma-informed. Non-informed, lack of education on trauma and prevalence, and universal precautions. So, if you're not trauma-informed, you could really trip over this stuff, and you could really trip over people's triggers. You can read this for yourself. I don't need to read this to you, but, just a few more. Assess for traumatic histories and symptoms. Cursory or no trauma assessment. Just to give you an example, one of the things that, in the field of domestic violence, it's been a lot of, very difficult arguments trying to get medical establishments to even screen for domestic violence. And that's just one possible source of trauma that we need to pay attention to. So if you're providing trauma-informed care, it just becomes part of your practice to screen for any kind of trauma. And within that net would then be maybe abusive relationship or domestic violence kind of situations so that you can get people help. Caregivers and supporters collaboration, and then there's rule enforcers and compliance. So it's kind of like here's objective neutral language, and then labeling language, manipulative, needy, attention seeking. So a lot of times, patients that are difficult, that are really just behaving because they're traumatized, are seen by the staff as, imperfect people, and so their effects of their trauma and their needs are minimized by these labels. So it's very important. And we're going to really weave this into our understanding of sexuality, so therefore we become much better service providers in whatever capacity we're providing service. So that's a quick overview of the trauma-informed care model. There is more information on this, more in-depth information in the course documents. Circles of Sexuality Model Overview. This is a model of interlinking components that contribute to a better understanding of sexuality. So the circles of sexuality, what are they? The first one is sensuality. There's also intimacy, sexual identity, reproduction and sexual health, and sexualization. So you can see these circles don't interact perfectly, but the idea is that there are just many layers. They all intersect, and none of them exist independently of the others. So using them all to define any instance where you're discussing sexuality is an advisable thing to do. So let's talk a little bit more about the circles. So first, sensuality. You've got body image. So one's body image refers to how someone feels about her body, how she feels about herself when she looks in the mirror. Feeling attractive is important to expressing sensuality. There's pleasure and sexual tension. So sensuality allows a person to enjoy pleasure when parts of the bodies are touched. People also experience sensual pleasure through taste, touch, sight, hearing, smell. So it's all five senses. Skin hunger. The need to be touched and be held by others in an affectionate way comes from skin hunger. It lets us know we're accepted, wanted, connected. Skin hunger can be expressed between parents and children, in friendships, and in loving and or sexual relationships. So it's important to see that with skin hunger, we're not just talking about sex, the act of sex, attraction, sex. We're talking about, the idea of being touched by your parents when you're young does contribute to your feelings of comfort and your feelings about being touched at all when you get older. It's also the feeling of physical attraction. The center of physical attraction is in the brain, not the genitals. The brain is the largest and most dominant sex organ. You'll hear people say that a lot in sexuality. What attracts one person to another is as different from one person to another as it can be the same. So, to each their own is sort of the phrase that people use there. And then finally, fantasy. The brain and body also gives people the ability to have and explore fantasies. Using the imagination to explore sexual scenarios, maybe daydreaming. Many people use fantasy as a way of wondering about what ifs, as in, what if I did that? Sensuality allows a person to explore scenarios without actually acting them out. This can teach a person a lot about what they like, what they don't like, how reality might be different from that of their fantasies. Sometimes people look to play out fantasies in real life, and sometimes not. The next circle is intimacy. So, intimacy is the ability to become close, affectionate, and loving to another person and to accept that in return. Important concepts that people should understand. First, sharing. Sharing is what makes personal relationships rich. While sensuality is about physical closeness, intimacy is about emotional closeness. Sharing is a two-way street. If one person is sharing and the other is not, then the intimacy is off balance and may not be totally genuine. Caring. Caring about others means sharing both joys and pains together. It means being open to emotions even when it is inconvenient. You always care about what happens to that person, and you get that caring in return. Attachment. This is a feeling that binds people together. You may be fond of someone or may love someone. Whatever feeling binds you together forms an attachment that is based on that feeling. There are healthy and unhealthy attachments. To figure out if an attachment is healthy or unhealthy, identify the feeling that it is based on and ask yourself if you think it's healthy. There's a lot of subjective material here in sexuality. The next is honesty and openness. This is about emotional risk-taking. It can be tricky to tell another person your private thoughts, hopes, and dreams. True sexual intimacy can only be achieved when two people show each other honestly and openly who they really are inside. And that leads us to the last concept, which is very similar to vulnerability. To have intimacy, we must share, care, attach, and be open and honest. This means people have to be able to trust another person or people, not to hurt them when they open up. Some people trust, get hurt, and refuse to trust again. However, if they want to have true intimacy, they will have to allow themselves to be vulnerable again. And there are ways in relationships that we're going to discuss further in this course that we can work on that. The next one is sexual identity. Hot topics. Sexual identity is a person's understanding of who she or he is sexually, including the sense of being male or female. Sexual identity consists of 4 interlocking pieces that, together, affect how each person sees him or herself. So first is gender identity. A person's gender identity is their own personal knowledge of whether he or she is male or female. Sometimes a person's biological gender can be different from that person's gender identity. For example, if you woke up tomorrow in the morning and your body was a male body, you would still be female inside, but your body would be male. So that's, what we would also refer to as transgender. Of course, if you're a male consuming this, then you have to turn it around and say you woke up as a female, but you get the point. The next is sex role. Male and female bodies have different reproductive organs. Sex roles are determined by biology. Males produce millions of sperm cells a day that can fertilize an egg. Women have eggs, can become pregnant, and give birth to new people. Hermaphrodites are people born with both male and sex organs, though many times they're not fully functional. When people undergo a sex change or feel they need to, they're referred to as transsexual. Gender role. Men's and women's roles in society and relationships are gender roles. How you act, what you wear, who's in charge, and when. A whole bunch of other rules that come from gender roles. Gender roles are currently changing in our society as women are expanding on the roles that are acceptable for them to play. In our history, women only got the right to vote in the United States in the year 1920. Women are now working as doctors, construction workers, and soldiers when, in the past, they weren't actually allowed to. Some people still try to hold on to old gender roles in which men were in charge and everything, and women were supposed to obey their boyfriends and husbands. A lot of this is, you'll hear this as traditional gender roles, but it's based on this idea that men are more capable or better than women in some way, and this is referred to as misogyny. Finally, sexual orientation. A person's sexual orientation depends upon the sex to which they are primarily attracted in relation to their own sex. If a person is heterosexual, if she or he is primarily attracted to people of the opposite sex to their own. A person is homosexual if he or she is primarily attracted to people of the same sex as their own. A person is bisexual if he or she is attracted to both sexes. Sexual orientation seems to emerge during adolescence but shows signs earlier in life. Heterosexism refers to some people's beliefs and actions that oppress homosexual and bisexual people's rights. Okay, so circle number 4 is reproduction and sexual health. This circle of sexuality refers to people's knowledge, attitudes, and skills relating to reproduction and sexual health. So there's factual information. This refers to how much a person knows about the facts of reproduction and sexual health. There is a lot of myths and misinformation spread about this topic. In society, many people try to talk, scare, shame, or guilt people into or out of having sex. Factual information assists in making accurate decisions. Feelings and attitudes. A person's feelings and attitudes toward their bodies and what they think about what makes the right conditions for reproduction and or sexual activity. People's feelings and attitudes about what is right and what is wrong concerning sexual activity and reproduction vary widely from person to person and place to place. Sexual activity is included in this circle. Knowing what sexual activities can lead to pregnancy or sexually transmitted infections is important to a person's understanding of sexual choices and their impact on reproduction and sexual health. Knowing about abstinence, contraception, and safer sex practices gives a person more control over his or her sexual choices. Anatomy and physiology. A person needs to know about their body parts, how they work, and how to keep them healthy. A lot of people don't know their reproductive organs and their reproductive systems and how they work together and how to keep them healthy, and diet and exercise and how they matter. So we're going to learn all about that. And finally, reproduction. A person needs to know all about human reproduction from sperm and egg to pregnancy to childbirth. People should know that during reproduction, half of the genes come from one parent and half come from the other. Also, a person should know what it takes to feed and care for a newborn and growing child as a parent. Last circle is sexualization. Sexualization is a way in which people add sexual aspect to an object or interaction. For example, flirting. Flirting is when people give playfully romantic sexual signals to others in conversation, verbally or non-verbally. It's only flirting if it's welcome. Unwelcome flirting can be sexual harassment, which I'm going to bring up in a minute. Seduction. Seduction is when someone tries to persuade or entice a person into sexual activity against their better judgment. There's advertising. This is also glamorization. Many products, like clothes, perfumes, shoes, cars, whatever, are sold with the idea that they will make you more attractive and more likely to get sex when you want it. Really, that is what it boils down to. We'll look more into that during this course. Sexual harassment. Sexualized harassment is when a person wants to harass, disturb, annoy, or bother someone else and makes it sexual. Sexual harassment is any unwanted sexual advance, request for sexual favor, or physical conduct of a sexual nature that creates an intimidating, hostile, or offensive environment. Rape and sexual assault. Rape is a crime that occurs when someone is forced or intimidated into sexual acts against his or her will and or without consent. Rape is a violent crime that is meant to hurt someone by using sex as a weapon. It is sexualized violence. And then finally, anything. Pretty much anything can be sexualized. Jokes, stories, hugs, any kind of object. Sexualization occurs when someone puts a sexual connotation onto something that is not inherently sexual. There's a lot of examples of this. We will be talking more about them.